I am very excited. It will be a new chapter of my life.
The care that she has gotten here has truly extended her life.
I'll be like in my own home, and to me that's important.
It's really an amazing, amazing place.
This is what care in a nursing home should be like.
It's really bringing the heart back to long-term care.
Hebrew Senior Life has been delivering care to elders for 106 years. The basic concept behind the model of care at the Gloria Adelson Field Healthcare Center at NewBridge on the Charles, we've tried to create an environment that is as much like home as possible. Long-term care is first and foremost about housing. So people are given their own room, they're provided real food out of real kitchens, and then on top of this housing setting, we layer on personal care, nursing care, medical care, all the things that are absolutely essential to frail elders, but we don't let the healthcare component dictate everything else. Rather, what we're aiming for is something that is as normal as possible, as much like a home as possible, but with all of these other critical ingredients layered in.
We've really taken the idea of a long-term care residential community and created a space that's much more home-like, a place where people would want to live, where they want to spend the rest of their lives.
When you walk into a typical household in the Gloria Adelson Field Health Care Center, the thing that you are most aware of is the oversized kitchen. And we wanted to do that to evoke what most reminds us of home. The kitchen has everything you'd expect to see in a kitchen. A refrigerator that has the ingredients for sandwiches if a resident wants to order something off the menu. There are dishwashers there so that we can serve our meals on real china, and there's real flatware. The kitchen has to one side a dining room area with a trestle-style dining room table. So instead of little tables that you typically see in a nursing home dining room, this table really feels like the dining room table that you might find in your own home. Next to the dining room is a living room with an entertainment center and comfortable chairs. You'll notice art on all of the walls. We're very proud of the fact that the art that we display is original art, much of it from artists from the greater Boston area. Instead of a nurse's station, which is kind of off-putting and tells you that you're in an institution, we have what looks like a large and attractive kitchen counter with drawers that are locked where we can keep the meds, large corridors so that we can have more than one activity going on at one time. There are carpets instead of linoleum floors. We've used vivid colors. The woodwork is beautiful. There are private rooms for the residents with large windows that admit lots of natural light and have beautiful views of trees and meadow. You know, we're hoping that one of the things that will happen in providing private rooms for residents is that they will feel that it really belongs to them and that they can customize it by bringing in a piece of furniture from their home. They can bring in art or photographs, things that will make this room truly their own. It will also have in each room oxygen and suction that's hidden behind a frame that looks like an attractive picture. Each of these rooms has a private bathroom with a private shower. We wanted the bathrooms to be both beautiful and functional, so they're very large. The sink and the toilet are both adjustable. They move back and forth so that if residents have a disability and favor one side, we can actually adjust to make it as easy as possible for them to use the facilities. We've also built a very large shower because we know from experience that most residents need assistance from a staff member. While we know it's very important for residents to have a place that feels like home, like the rest of us, every once in a while you want to go downtown. So we've tried to create some variety in the living space, something that really feels like home. This neighborhood center where residents can go, and then at the floor level, a place where residents can come for larger gatherings for live entertainment.
It's the most amazing facility I've ever seen. There's nothing clinical looking about it.
It doesn't look like an institution, like a hospital. It looks like a home.
The goal of the optimal living environment is to allow people to attain their highest degree of independence function, and yet have the highest quality of life.
In a typical institutional model, the person is required to do what the institution wants them to do. The schedule is built around the institutional needs. We're turning this around. The person decides what they want to do. They choose when they want to have a shower, what they'd like to have for dinner, who they want to hang out with. And part of that will be us, the staff, making people feel comfortable.
I look forward to making the quality of my residents' life much better, much happier, and much easier. To me, it would be a new beginning because it's going to be a whole different concept.
This will be the first paperless long-term care community in the United States. Having this technology in place allows staff to spend more of their time with their hands on residents and less time with their hands on paperwork.
We are constantly trying every day to set a new bar.
I trust people here. I know that she's safe. I don't have to worry about her at all.
My mother would not be alive today if it weren't for the care that she gets here.
When people see what we've created here, it will really change the course of history going forward. That long-term care will be different as other people see how much better it could be, and I hope try to replicate what we have done in developing the Gloria Adelson Field Healthcare Center.